Should I go to the dentist while pregnant? Hi, I'm Dr. Judith and I'm one of the principal dentists here at Elevate Dental in Melbourne. Earlier today, we received a call from one of our regular patients, Amelia, from Hawthorn, who is now an expecting mum. It was super exciting. Next week is a scheduled regular dental checkup, so she asked, should I still come and see you even if I'm pregnant? This is quite an interesting topic, so I thought I would make this video to talk to you about how pregnancy and dental health relate to each other. When you're pregnant, it's actually even more important to keep your oral health and teeth and gums healthy. When you're pregnant, you're actually at a higher risk of developing tooth decay and gum disease and other issues. Your dental health has a really big impact on your overall health, which means it can have a big influence on your baby too. Here are a few common things to be aware of during your pregnancy. Number one, pregnancy hormones can make some people be at risk of gum problems that include gingivitis, which is inflammation of the gums. That's actually more common and more likely to occur during the second trimester. What you may feel is an increased swelling of the gums and a lot of bleeding, especially during brushing and flossing between the teeth. And the gums can actually get quite sore. Gum disease in expecting mums can contribute to low birth weight babies. What happens is, in the immune system, there are two sets of proteins called cytokines, and they regulate your body's response to inflammation. There are pro-inflammatory cytokines and anti-inflammatory cytokines. In a normal full-term pregnancy, proteins that encourage inflammation in the body are regulated by those that decrease the inflammation, because what it wants to do is to prevent the body from developing inflammation and rejecting the fetus and the baby. What happens when you have gum disease is that it causes an imbalance of these proteins, which then creates more inflammation in your body and can result in more complications during the pregnancy, especially at the end. It's really, really important to make sure that your gums are healthy during this time. Another thing that we look out for during pregnancy and a lot of new moms experience is morning sickness. You know, that horrible feeling when you're nauseous and sometimes you end up over the toilet bowl vomiting or just getting reflux and regurgitation. This is very, very common, and it's also really, really important to protect your teeth during this time, especially in the first trimester. This is because when you do regurgitate, when you do have reflux, there's a lot of acid in your teeth and around your mouth, and this can erode and dissolve away your enamel. If you're experiencing morning sickness, it's really important to remember, definitely do not brush your teeth straight after the episode. When there's more acid around your mouth, after morning sickness, it actually softens and weakens the enamel in your mouth. And when you go and brush your teeth straight after that, you'll end up brushing away part of your enamel. What we generally recommend is to rinse your mouth out with water afterwards, and definitely don't brush your teeth until at least 30 minutes afterwards. So these are a few reasons why routine check and cleans are really, really recommended whilst you're pregnant, to make sure that all the teeth and gums are healthy. Sometimes you may still experience dental pain and you might experience a dental emergency. What happens then? Generally speaking, with all treatments, we recommend having them commenced during the second trimester when pregnancy is most stable. A lot of people ask, well, are x-rays safe? Is any sort of dental treatment safe? And the answer is, modern x-rays use a very, very low dose of radiation, and a single dose is not usually high enough to cause any adverse effects in the development of a baby. We always try to make sure that your baby is shielded from radiation by using a lead apron over the area. Now, although x-rays are safe, we may still recommend avoiding them during the first trimester if you're only having routine checkups. But if you have a dental emergency or severe non-specific pain, then an x-ray will be needed to help us plan your treatment effectively. The same goes with an anesthetic. If you need to have a dental procedure whilst you're pregnant, an anesthetic can still be used safely to help you relax and to numb the pain as well. This is also very, very important that you let us know about your pregnancy so that we can choose the right anesthetic for you. I hope that's helped. I'll give you a better understanding of why you should still come and see your dentist if you're pregnant. If you're expecting and want to organise a time for a dental visit, we would love to look after you. We're conveniently located in both Hawthorn and Richmond with on-site free parking. Give us a call on 1300 to SMILE, complete the form on our website, or send us a DM on social media, and we'll be in touch to help you organise your consultation. See you in the next video.